I've been collaborating with the MINT Memory Clinic model since 2008. I believe it benefits the people who have memory complaints, particularly those in rural and remote communities where they may not have the opportunity to see specialists and where waiting lists may be a long period of time. Reduced healthcare costs, and that was attributed for a number of reasons. They were less likely to go to emergency rooms. If they were seen in hospital, they would be discharged earlier. Admission to long-term care would be delayed, having been assessed by through a MINT memory clinic. More importantly is their problems identified really early on. And so I think this is where the biggest impact will be in terms of cost savings to the healthcare system, having well-informed patients who are using the resources that are most appropriate for them rather than going to places like the emergency room when they're in crisis. And this is where the costs are when you have people turning up in the wrong place and not being provided with the care that they need. The MINT Memory Clinic is a model that is leading the way in providing comprehensive care to families in rural and remote areas within larger urban areas as well. We know that there are partners in the community that are going to build on what we've done. And so if there was a specialist who was hesitant about being engaged, I would encourage them to embrace it. I think collaboration across multiple specialties in an interdisciplinary way is really important, because you can bring the expertise of all of the different disciplines to bear on what is really a very complex disorder. Dementia is incredibly complex. Can offer the families resources from different specialties. It could be a pharmacist, it could be a social worker, it could be someone from the Alzheimer's Society who have particular expertise that would be able to help them. And we can be more precise about our diagnosis, maybe more precise in terms of the trajectory, in terms of the prognosis. And that's why there needs to be more people trained within the family health teams, using models like the MINT Memory Clinics to actually deliver integrated care across a range of disciplines that are going to best address the problems that people have. I think inevitably will improve care for the patient and for their families. It needs to be expanded further.